competitive healthcare. I want to go to a competitive healthcare system where people get to pick from about a dozen different competitive healthcare systems. So instead of having one healthcare system, well, we kind of have several because government's involved. We have insurance, heavily regulated by heavily regulated by government. We have the government actually administrating healthcare with military, the VA, and others. We have government majorly funding healthcare through Medicare, Medicaid, then again through the military, the VA, and the like. But even if it's then the healthcare and the requirements for, let's say, the emergency room require that the free enterprise system does certain things, and then the government tries to backfill that with some funding to some ERs, to hospitals, to healthcare systems. All this involvement has created a significant rise in prices, significant inflation, even much higher than the general inflation for healthcare, because healthcare is so involved in the government. So it's much higher inflation. It's not higher because of the free enterprise system. It's much higher because of government's regulating, government's involvement in so many areas of government of healthcare, from health insurance to health providers to the education surrounding healthcare, the certifications required, the licensing requirements, the mandates that you go through a certain amount of education, which sometimes can be really, really good. Don't want to get rid of all that, but when it's all government regulated, all government decisions, it raises the price significantly. It prices people out of the market, where a lot of people who would be able to get a lower level of healthcare in the free enterprise system now is priced totally out, so you can't get any unless you go through government, and then there's a lot of issues there. Let's go through this a little bit and talk about more things. Regulating higher standards means better services. However, it also means pricing the poor out of this market, meaning no quality because there is no service. If, again, just like minimum wage, it prices so many people out of the labor market. So instead of them being able to make some money and work themselves up, gaining more skills, more experience, and then gaining a higher level of pay, it prices them all the way out. Same thing with educate or healthcare. You require so much, and you won't be able to get any because you cannot reach that first level of on the ladder. And then government tries to take over, and now they control you. And that control is very similar to slavery. Slavery, you had a one-payer system by the master. Let's say he owned 100 slaves. That slave owner was a decision maker on whether you got health care. Obviously, he wanted to give you health care to get you back in the fields to pick more cotton or whatever labor you were doing. Horrible, horrible system. The healthcare system, controlled and operated by a one-payer system, is very similar to slavery in that aspect. So we shouldn't be doing that. So higher regulations sometimes can be really, really good, but you have to realize you're pricing people out of the market so they get zero care. This also means that delayed care after the disease has done permanent or fatal damage. So a lot of people, let's say in some one-payer systems up in Canada or some of the European nations, they have such a long wait time to get in to see the doctor that the delay of care means that cancer spread too much. It has done permanent damage or fatal damage, or it keeps you out of the workforce much longer. You don't have the option of going to a private provider in some of these one-payer systems. Some allow people to go on the outside or escape to go to America to get their service, but some don't. Or they give you such a high punishment to do that. But some people want to live, so they'll take that punishment regardless. Lower quality care due to lower cost, thus and thus a greater number of patients being seen can result in more preventable illnesses being caught. So even if you have a lower level of care that costs less, it will build a spot and do a screening mechanism to prevent more illnesses and treat people faster. And it will allow more business models that could be a lot more productive. So people want to, and that'll tell people when to go to a higher level of care if they have to start with at least have an option going to a lower level of care first. So going to a nurse versus a doctor is what I'm trying to say. A doctor's appointment would be a lot more expensive than a nurse's, but at least a nurse will be able to have a protocol saying, this is out of my range, you really need to go up, I'm seeing problems. Imagine if the regulations stated that only the top rated and most experienced 1% of doctors were allowed to see patients. That's talking about significant increase in standards. The waiting lines would exclude patients to the point of never receiving care, and then nobody gets care because we put the standard so high. So where do we put that standard? Let the free enterprise system do that, and then allow business models to have a lower cost, so more people can be seen, at least be screened, to say, hey, you really need to up your game and go up to a higher level and get more care. The government cannot possibly reach that balance. What balance do we want to use for allowing certain things to happen? Not going all the way up to only the top 1% of doctors can see patients, because obviously 99% of patients wouldn't be seen then. But we also don't want to go too low. But can government reach that balance? No, they can't. Not in a monopolized way. Having 12 complete healthcare systems. Now, most healthcare systems will allow you to mix and match and integrate yourself into many different healthcare companies and healthcare providers that are maybe governed under another healthcare system. So I'm not saying that you can't cross paths, that you have to stay within the one system. Now, maybe in some high population areas, you could have one complete system that you could stay within. But in low population areas, no, obviously 12 can't work if you have to stay only in that one system. So a good healthcare system will allow people to go outside their system, but still be part of your system. Because they get to make the governance on that. And each individual gets to pick what system they want to go into. Each healthcare provider, whether an individual or a business, gets to decide what healthcare system they want to go into. And obviously most want to go into where there's flexibility there. So having 12 complete healthcare systems would allow many models to be tested, with several approaches likely to succeed. But some models won't succeed, and they will naturally lose enough customers that they have to go out of business. And that is the best part of free enterprise. The best part of free enterprise is saying, having the market say, we're not paying you for the service anymore because we're not getting good results. I'm going somewhere else to pay them for that service. And then they don't have control over labor hours anymore because they did not do a good job. So failure is a major part of free enterprise. One of the best parts of free enterprise is that failure, because that failure stops allowing somebody to or use labor hours. The others will have to follow to the more successful models. So a few will succeed really good, and that will drag a lot of people up to their models. Well, right now we have a government model, and that's the only one that's allowed to be done. Now there's a little bit of flexibility from insurance to providers, but they're all so heavily regulated that their flexibility is limited. Lawsuits also keep the flexibility down significantly. So the whole court system and what happened with that really tighten up. So you have funding, what they're going to fund, the regulations, insurance, education, what's allowed and not allowed is so important. The others will have to follow to the better models because the patients will demand it. And I will have a good rating system, competitive rating system to address each one to give good, clear information to all the citizens. Their members will have to switch to more successful models, therefore taking away the failing models out of the system. A lot more to see at Haley2024.org. Until the next video.